Assalamu alaikum wa rahmatullahi wa barakatuh. Welcome to High Yield Medicine with Furat. Today we will talk about herpesviruses, high yield topic for USMLE exams. We have 8 viruses, HHV, 1, 2, 3, 4, 5, 6, 7, 8. HHV means human herpes virus. Okay, let us start. Before we start, I want you guys to know that herpes viruses have or are double-stranded, enveloped linear DNA viruses. This is something very important to know and to memorize, specifically for USMLE Step 1. Okay, so let us start by talking about the first 2 viruses, HHV1 or HSV1, related to herpes simplex virus 1 and 2. I'm going to talk about them together because they can cause the same manifestation with slightly differences. Okay, so اي شيء هسه راح احكي عنه هو بنطبق على ال HSV1 وال HSV2 الا اذا بحكي لكم هذا الشيء سبيسيفيك لهذا التايب. اوكي، لكن في عندنا slightly differences. في اشياء common تيجي مع ال HSV1 وفي اشياء common انها تيجي مع ال HSV2. Okay, let us start. So herpes simplex viruses 1 and 2 both can cause painful vesicular lesions. Okay, the lesions is vesicular, fluid filled vesicles. Okay, where in the lips and genitalia. Both can cause vesicular lesions in genitalia and lips. Okay, guys? But HSV1 tend to do it more on mucous membrane like lips and 2 more on the genitalia, but both can cause both. Okay, so they can cause herpetic whitlow, which will be vesicle on the finger. Okay, herpetic whitlow is a vesicle on finger. This is something important. They can cause herpes labialis, which is cold sores or canker sores. But be aware that cold sores can be idiopathic, can be caused by stress, heat, spicy foods. Okay? Both can cause encephalitis and meningitis. So encephalitis means inflammation of the brain parenchyma, the brain tissue itself. And meningitis means inflammation of the meninges around the brain. Okay, guys? Okay, now let's talk a little bit specific. Going to HSV1, herpes simplex virus 1. It is transmitted by respiratory secretions and saliva. And this is important. So who has the highest risk? Dentists, dental workers, dental hygienists, children, neonates. Okay, because they can simply put their finger on the mother's mouth during breastfeeding, as an example. Okay. So HSV1 tend to cause encephalitis more than meningitis versus HSV2, which tends to cause meningitis, more common than encephalitis. This is something important to say. Okay, so how the encephalitis will be presented? So HSV1 can cause temporal lobe encephalitis and specifically hemorrhagic type. So if we obtain a CSF sample, cerebrospinal fluid sample, we will find a lot of RBCs. We will find blood, and this is something buzzy for temporal lobe encephalitis caused by HSV1. Okay, guys? And HSV2 tend to cause viral meningitis. Okay. Now, if you face a vignette saying that a dentist is presented to your clinic complaining of a lesion, a fluid-filled lesion or a fluid-filled vesicle on his finger, what's your diagnosis? It will be herpetic whitlow, HSV1. Okay, because he's a dentist, he has a higher risk than others because his work demands him to put his finger inside the patient mouth. Okay. It can cause herpetic keratitis, inflammation of the cornea, and actually it's caused by HSV1 more than HSV2. It's gonna present as a dendritic ulcer, a tree-like ulcer. Okay, guys? It can cause gingivostomatitis on the lips, on the angle of the mouth will be vesicles also. It can cause esophagitis, and specifically in immune compromised patients, like a patient on chemotherapy or HIV infected patients, etc. Okay. And HSV1, actually it's presented with some type of skin rash. It's a target skin rash called erythema multiforme. Okay, actually it is the most common identified cause of erythema multiforme is HSV1. Okay, this is so important, but remember, erythema multiforme is not specific of, it's not pathognomic also for HSV1. Okay. One more thing I want you guys to know, that HSV1 tend to go latent in trigeminal ganglia. Where? In the trigeminal ganglia, cranial nerve number 5. Okay. Herpes simplex virus 2 tend to be transmitted by sexual contact specifically, and perinatal vertically. Okay. It tends to cause more herpes genitalis, which is the vesicles on the genitalia, also cause viral meningitis. Okay. And one other difference, that HSV2 tend to go latent in sacral ganglia versus HSV1. We said 1 minute before that it tend to go latent in trigeminal ganglia. Okay. Now, guys, I want you to be aware of something called eczema herpeticum. Okay, eczema herpeticum, which is HSV1 or 2 infection superimposed on eczema. So the patient would have prior diagnosed eczema, and a superimposed HSV1 or 2 infection will be. Okay, it can present with burning pain, which is called herpetic neuralgia. Okay, guys. Okay. How we treat the HSV1 or 2? By acyclovir. But if the patient presented with encephalitis or meningitis, we're gonna use IV acyclovir. Okay. Now let's move to HHV3, which is called varicella zoster virus. Okay, varicella zoster virus. It will cause chickenpox and shingles. Okay, how it will be transmitted? By respiratory secretions or contact with fluid from the vesicles itself. So guys, anyone who have shingles or chickenpox, remember, do not touch fluid from person's vesicles. It would be very dangerous. Okay. Now, it will cause chickenpox and shingles, as we said, but USMLE actually cares about shingles more than chickenpox. Okay. Other name for shingles is herpes zoster. It's not the name of the virus. No, it is other name for shingles. Okay, guys. Okay. Shingles will present as vesicles in dermatomal distribution in the flank, back, or neck. The cause is idiopathic, but it can be indication of immune compromised state, like someone who's in chemotherapy, HIV infection, etc. Okay, guys. Okay. Okay. Now, varicella zoster virus, it's gonna go latent also to trigeminal ganglia, like HSV1. So they have one complication in common, which will be something called herpes zoster ophthalmicus. Herpes zoster ophthalmicus, which is periorbital vesicles, okay, near the eyes. Why? Now, because they both go latent in trigeminal ganglia, and the trigeminal ganglia related to trigeminal nerve, cranial nerve 5. We have 3 sub-branches, V1, V2, V3. V1 is ophthalmic branch. So it can attack the ophthalmic branch and cause what? Herpes zoster ophthalmicus. Okay. Now, one thing to say about varicella vaccine. I want you guys to know that varicella vaccine is a live attenuated vaccine. Okay. So we can give it to immune compromised patient. We cannot give it to pregnant ladies. We cannot give it to any HIV patient with lower than 200 CD4 plus, and we cannot give it to any neonate under 1 year old. Okay, guys? Okay. Now, let us move to HHV4. Other name is Epstein-Barr virus, EBV. Okay? It's transmitted by respiratory secretion, saliva, and kissing. So it is also called the kissing disease. Okay? It's common in teenagers, in young adults, etc. I want you guys to know that it can cause something called mononucleosis. Okay? EBV mainly cause mononucleosis. So how mononucleosis will be presented? It will be presented with fever, pharyngitis, hepatosplenomegaly, and lymphoadenopathy, specifically posterior cervical lymph nodes. But again, it's not specific. It can present with anterior cervical nodes. Okay, guys? Okay. So remember, mononucleosis mainly caused by EPV, Epstein-Barr virus, HHV4. It's gonna present with pharyngitis, sore throats, fever, hepatosplenomegaly, and lymphoadenopathy, specifically posterior cervical nodes. So remember one thing also to say to anyone infected with EPV or anyone has mononucleosis is to avoid contact sports, okay? Why? Because they have hepatosplenomegaly, to avoid the risk of splenic rupture. Okay, guys? Okay. Other thing to know that EPV is associated with lymphomas, Hodgkin and non-Hodgkin lymphomas, is associated also with nasopharyngeal carcinoma, which will be squamous cell carcinoma, absolutely, and malignancies in transplant patient, immune-compromised patient. So it can cause many serious problems in immune-compromised patients like lymphomas, Hodgkin, non-Hodgkin, nasopharyngeal carcinomas, and other malignancies. Okay, one other thing that I want you guys to know that EPV can cause hairy, what? It can cause, oh my God, I forgot it. It can cause hairy leukoplakia. Hairy leukoplakia. Remember, it is a white lesion on the tongue that cannot be scraped off, but it is benign. It is not precancerous. There will be no dysplasia on biopsy versus regular leukoplakia, which will be precursor to squamous cell carcinoma. Okay? Okay. EPV will infect B cell. For that reason, it has increased risk for lymphomas. It's gonna infect B cells through CD21. This is something important, guys. I want you to know. Okay? So the receptor for the EPV virus is CD21. It can infect the B cells through CD21 receptor. Okay? Okay. I want you guys to be aware of something called mono spot test. Mono spot test. Okay. Now to understand that test, I need you guys to know some of weird thing that anyone who's infected with EPV, their immune system will produce antibodies. For some reason, these antibodies can cross-react with sheep or horse RBCs. Okay, so during monospot test or heterophile antibodies, we will detect the heterophile antibodies by agglutination of sheep or horse RBCs. Okay, okay. One last high yield, extremely high yield thing to know, that anyone with mononucleosis who tried to use amoxicillin, it can cause maculopapular rash. This is something high yield actually and buzzy for mononucleosis. Okay, let us move to HHV. It's called CMV, cytomegalovirus. Cytomegalovirus. It's gonna be transmitted by sexual contact, saliva, respiratory secretions, urine, and congenital. Okay, vertical, congenital from the mother to the baby. This is something extremely high yield. Okay. So CMV is the most common organism that's transmitted via blood transfusion and organ transplant. So remember, it's gonna transmitted by sexual contact, saliva, respiratory secretions, urine, vertical from the mother to the baby, and the most important and the most common, blood transfusion and organ transplants. Okay, guys? Okay. It's gonna infect many organ systems like the lung, kidney, GI tract, eyes. Okay. But I want you guys to remember one thing. It can cause mono-like presentation, or you can call it mononucleosis with negative monospot test. Okay? Specifically in immune competent patients who have a good immunity. Okay? But if it infected someone who is immune compromised, it can cause pneumonia in transplant patient. It can cause esophagitis in HIV patient. It can cause colitis in someone who's on chemotherapy, as an example. And it can cause something called AIDS retinitis. AIDS retinitis. Remember this. Blurred vision in HIV patient. This is CMV, cytomegalovirus retinitis, until proven otherwise. Okay, guys? Okay. So how we can differentiate between CMV mononucleosis and Epstein-Barr mononucleosis? Easy, by monospot test, by heterophile antibody. It's gonna be negative in cytomegalovirus mononucleosis. Okay. How we would treat it? By ganacyclovir. Okay, by ganacyclovir. Okay. One last thing I want you guys to know. Actually, two last things. Yeah. On histology, USMLE could say or describe the finding as intranuclear inclusions or intranuclear inclusion bodies. Okay, and this is referred to owl eyes that can be seen on the histology. Okay, and the last thing, that cytomegalovirus tend to go latent in mononuclear cells like macrophage. Okay, now let us move to HHV6. HHV6 would be transmitted by saliva. It can cause something called the sixth disease, or exanthem subitum, or rosella infantum. Okay, this is very easy. Remember, guys, it will be presented in child that had a high fever, then boom, maculopapular rash, diffuse macular rash. Okay, remember, rosella infantum caused by HHV6, spiking fever, high fever, followed by rash in a child. Okay, so the question can be a rash in a child that started on the trunk, then spread it to the extremities, and it was preceded with high fever. And sometimes they can say that the high fever caused febrile seizure. Okay, very easy thing. Now HHV7, also transmitted by saliva. It can cause pityriasis rosea. Okay, it's a rash that starts with one large patch called herald patch, pink patch, and then a little tiny patches will follow it. Okay, and it will cause the Christmas tree distribution on the back and shoulders. It's self-limiting. Okay, now let us move to the last virus we have, which is human herpes virus 8, HHV8, or Kaposi sarcoma associated herpes virus. So it can, simply from its name, it can cause something called Kaposi sarcoma, okay, which is a tumor of the endothelial cells. Tumor of the endothelial cells, okay, seen in HIV/AIDS patient or immune compromised patient, transplant patient, someone who's on chemotherapy as an example, it would be described as a dark, violaceous plaque or nodule. Okay, it is so important. It can affect the GI and the lungs, but it's more the most thing to know that it can cause Kaposi sarcoma in immune compromised patient, and it is transmitted by sexual contact. Okay, so before we wrap it up, let's talk about HSV1 and 2 and HHV3, varicella zoster virus. Okay, the test of choice for identification and diagnosis would be PCR of a skin lesion. Okay, so remember, PCR of a skin lesion is the test of choice. PCR of a skin lesion is the test of choice. Okay. If he said that the patient has encephalitis, herpes encephalitis, like HSV1 and 2, and commonly in HSV1, the test of choice would be CSF PCR, okay, cerebrospinal fluid PCR for encephalitis or meningitis. Okay. Now, one of the outdated tests formerly was used. It's Zank smear or Zank test. It's gonna show us the multi-nucleated giant cells. But now the first choice or the test of choice is PCR of the lesion. But in case of herpes encephalitis or meningitis, we would do what? CSF PCR. Okay. So histological findings for HSV1 and HSV2 and varicella zoster virus, HHV3, will be intranuclear eosinophilic inclusions called Cowdery A inclusion. Okay, guys. So I think we wrapped it up, and we talked about herpesviruses in a comprehensive way. I think you can solve any question on that topic.